Hi, this is Carissa Caramanis O&rsquo coming to you from the National EMS Culture of Safety Strategy Conference in Arlington, Virginia. I'm here with Ron Siarnicki from the National Fallen Firefighters Foundation. Welcome.
Thanks for having me here today. It's been a pleasure to be able to attend the EMS Safety Culture Conference.
Well, we're happy that you're here. So tell me a little bit about the foundation and its mission.
The National Fallen Firefighters Foundation was created in 1992 by Congress to do a couple of things: to honor every fallen firefighter in America, to assist their families in the rebuilding of their lives, and to work with the fire service community to reduce firefighter line of duty deaths.
So obviously that last part has a key role in preventing death, and that has a lot to do with safety. So why is safety such a core importance to the foundation?
Well, the first part is, for years, we've honored the fallen firefighters at the National Memorial. But by adding to our mission the prevention of line of duty deaths, we've been able to cause less traumatic occurrence for the families. That's what it's all about. If we reduce firefighter fatalities, there's less families that have had the loss and less families that we need to care for. So the prevention piece makes an obvious connection. And by reducing firefighter deaths, we're also putting in programs related to safety and survivability of firefighters to reduce injuries as well. So it's all around good for everybody.
Now, I know that you're a federal organization, but you're a nonprofit, and you rely on the collaboration and support of a lot of other organizations. This is very much a collaborative effort as well. Can you speak to sort of the importance of that collaboration?
Any program that's going to take on a national issue, such as safety and changing a culture within an organization, has to be collaborative. Everyone has to work together in order to carry the mission forward. Everybody has to pull their weight. Everybody has to contribute in one fashion or another. And the criticality is making sure that we're all going in the same direction. So when we were asked to come down and provide an update of our program and our activities, it was a logical fit so that people could learn from the lessons that we've had, the issues that we've faced in developing our life safety initiatives for the fire community, so that the EMS community could share with that and benefit from those experiences.
And it's great that you're sharing that so that others can learn from it as well.
Absolutely.
So speaking of those initiatives, can you tell us a little bit about the Everybody Comes Home program?
Yes. In 2004, we hosted a national summit in Tampa, Florida, in which we tried to develop a blueprint of activities that could be done on a nationwide basis. I can't even speak. On a national basis. Let me start over because that was out of it. In 2004, we hosted a national summit down in Tampa, Florida, where we had all the major fire service organizations come together to talk about the development of a blueprint for reducing firefighter fatalities and injuries in America. 16 specific life safety initiatives were developed. Those have become kind of the roadmap that organizations, departments, and entities could use to reduce firefighter deaths and injuries. Those elements have been supported through grant funding from the Assistance of Firefighter Grant Program and from private industry to carry that message to all levels of the fire community, helping to get people to be accountable and responsible for their own well-being, thus reducing deaths and injuries in the community.
Very good. So you've been here for a little bit today and taking part in some of the group discussions. How has that been? Any key learnings from that?
It's been pretty good to sit and listen to the different members of the teams talking about these issues. It kind of was deja vu a little bit because we went through that process as well when we developed the 16 initiatives. The best part is we were able to today to provide some insight into what we experienced and what we had go on when we did it. So it's a process, though. It's a consensus process where everybody has to contribute, and there needs to be some trial and error to see what's going to work within the EMS community. Changing culture is a major initiative. It's a major step. There's a lot of work ahead, but it's doable, and it can produce results of reductions in line of duty deaths and injuries down the road.
Absolutely. Well, we thank you for sharing your insights and experiences and for being here today. Thanks.
Thanks for having me. I appreciate it.
Again, this is Carissa Caramanis O&rsquo coming to you from the National EMS Culture of Safety Strategy Conference in Arlington, Virginia.